Premature Infants, created by Alexis Cerda, Ruth Cruz, Mariah Saldana, Yvonne Dodson, Lauren Garcia, and Michelle Dolan.
Come in. Hello, Mrs. Dodson. My name is Dr. Garcia. Your results came back. You're 39 weeks, and we're going to go ahead and induce labor to ensure that your baby has a healthy delivery.
The average and optimal growth development for newborn infants includes a weight of greater than 5 pounds and a greater than 35-week gestational period. Luckily, most babies in the U.S., over 90%, are born at an optimal size and weight, according to Sandtrock on page 68. As a result, these infants come into the world having a healthy immune system and organ systems.
Congratulations, Mrs. Dodson. You have a healthy baby boy of 8 pounds and 19 inches. Congratulations.
So how's my baby doing?
Well, you have a very healthy baby, very healthy organ system and brain development. He was born above the 50th percentile on the growth chart, and he has a healthy immune system.
Why are those babies so small?
Those babies were born prematurely.
What causes that?
Well, there's several things that cause low birth weight and prematurity in infants.
A fetus is considered premature when born 3 weeks before or before 37 weeks. The cause of prematurity is not clear, but there are a few risks that may increase premature birth. Having preeclampsia on the first pregnancy can increase the risk for developing it again for the future as well, and causing premature birth. Another risk might be when a woman is pregnant with twins, triplets, or multiple children. Also, complications with the uterus or cervix can be a cause to premature birth. Being underweight or overweight can cause prematurity with disabilities. Final, having been or having a family history with premature birth can be a medical risk factor before pregnancy.
There are also medical risk factors that take place during pregnancy. One of these risks include having a connective tissue disorder. There are several disorders that are genetic and can be passed down from mom to baby. Gestational diabetes is something that can be managed and kept under control, but if it's not properly taken care of, then we can expect the possibility of a premature birth. In addition, gestational diabetes also raises the risk of developing high blood pressure and preeclampsia. According to marchofdimes.org, 15% of premature labor is caused by preeclampsia. Prenatal care is essential during pregnancy, and without it, there can be serious problems that come from it. Alcohol, smoking, and abusing drugs affects the baby significantly by causing developmental problems, which can lead to premature birth. Stress is healthy for everyone to experience. However, experiencing high levels of constant stress can negatively affect the baby. Lastly, certain ages and races make women more likely to experience premature labor. Women that are under the age of 17 or older than 35, and for race-wise, African American women are more likely to give birth early. Survival rates for preterm and low-weight infants has increased, but with this increased rate of survival, the rate of severe brain damage increases as well. Preterm and low-weight infants are more likely to develop a learning disability, attention deficit hyperactive disorder, autism spectrum disorder, or breathing problems such as asthma. Approximately 50% of preterm and low-weight infants are enrolled in special education programs.
According to Dr. Virginia Frisk, prematurity impacts a child's intellectual ability, thinking, memory, verbal skills, and ability to learn due to the complications of their birth. Injuries to the brain such as intraventricular hemorrhage, a type of bleeding into the ventricles of the brain, and hypoxic ischemic damage are associated with impaired intellectual ability and behavioral problems. According to the article Growth and Development After Prematurity, 2012, Your baby's development will depend on their genetic makeup, the environment, and their influences. If a baby is born prematurely, their milestones will be assessed from the time of their due date, not from when they were actually born. By the age of 2, their development will even out with their peers, and you can use their actual birth date instead.